Two mothers from the Northwest have told MPs about the devastating effects an epilepsy drug they were prescribed while pregnant has had on their children. They've been campaigning for decades to get compensation for families affected by sodium valproate, which can cause lifelong disabilities. Well, today they welcomed what could be a step towards financial help. Our political correspondent, Lise McNally, reports.
Janet and Emma have been fighting for their children all their lives. Now they fight for thousands more, campaigning for babies born with lifelong disabilities because of a drug their mothers were prescribed while pregnant, a drug that is still being prescribed. Today they appeared before a panel of MPs to share their story of taking sodium valproate and the impact it's had on their children.
Me and my husband, we questioned at every appointment, would valproate harm during pregnancy, and we were never warned at all. I've now obviously 5 children affected, and they're all diagnosed with fetal valproate spectrum disorder.
We realised that neither of them were doing the usual milestones. They weren't reaching for toys. Smiling came very late. Walking was very late. Speech.
Today's session followed an independent review of sodium valproate, which set out 9 recommendations for the government. As of last night, 6 had been fully or partly implemented, but the need for an independent agency to oversee a compensation scheme was rejected. It means a family's only option is to sue for clinical negligence.
Families have already been there and it's not worked. They've got nowhere to go. They're coming up against a brick wall constantly, all the time. And that brick wall is being put in place by the government.
These are families who are really struggling with every element of bringing up a disabled child. And it's not the NHS's fault. The government know that.
But their message seems to be getting through. Today, a newly reappointed health minister